Hello, I'm Sakir Ahmed. My delegate ID is 126, and my work is breast lumps diagnosis with minimal resources. As we know, the female breast has a charisma which symbolizes femininity. Any mutilation of the breast by surgery or by disease is deemed as equivalent to loss of femininity. The need of today is primary health care, which speaks of appropriate, adequate, accessible and appropriate technology which is accessible to the masses. So this study was started with the aim of optimizing the diagnosis of breast lumps with the minimum of effort. The facts are there before us. The incidence of breast carcinoma is increasing. It is a leading cancer in females in many parts of our country today. And benign breast disease, even though prevalent, very rarely presents to the physician. So we hypothesize why this can be happening. Maybe the patients are unaware, maybe they are aware but still do not go to the physician. Maybe the diagnostic facilities are at fault. Maybe the investigations are not proper, giving faulty results, or they are too costly to be afforded by the patient. So we included all patients coming with a palpable breast lump to our college, Assam Medical College at Dibrugarh. And we collected 4 sets of data: the patient awareness, the clinical evaluation including known risk factors, the laboratory investigations, and finally the patient compliance. Coming to the results, we got 55 patients, out of which 24 were diagnosed as benign, 14 were diagnosed as malignant. We had 12 who were diagnosed clinically as benign, but there was not conclusive proof from the laboratory, and 5 cases remain undiagnosed. Here is the pattern of diagnosis, number of cases of each. And coming to patient awareness, we saw that the patient usually noticed the breast lump mainly because of pain, or it was an accidental discovery. And the commonest cause of coming to the physician was always pain. Breast self-examination was sadly lacking in our patients, with only 2 patients doing it. And the socio-economic and educational background obviously was comparatively poor. Looking at the clinical side, we saw that there was no statistically significant association with known risk factors, but it is to be expected because of the small size of the study. The clinical features were correlated with the final diagnosis, and there was a high match. The sensitivity and specificity were relatively high and quite acceptable. Next, we examined the laboratory findings. We saw that the most irrelevant investigation was the repetition of the FNAC, which was because of sampling error, but this again is inherent weakness of FNAC. However, the sensitivity and specificity of FNAC was quite high. The commonest investigations following FNAC were ultrasound and histopathology. Finally, coming to patient compliance. The cost factors, as we can see here, should not be a deterrent. However, I do not have any studies to compare this and will not be able to comment. However, the patient compliance was very poor, with 1 out of 4 patients not coming back after the first visit. Hence, we have such a number of undiagnosed cases and cases which are diagnosed but could not be confirmed. So overall, we can see that awareness is very, very poor. The clinical assessment is good, so are the laboratory investigations, and even the compliance of patients requires some improvement. Ultimately, I can conclude that the diagnostic facilities are working optimally, and I give much credit to people who are giving the adequate diagnosis with the minimal of resources. The main limiting factor is obviously the poor awareness of this patient. I will not give a take-home message, but my message is for the masses. We can make a difference by spreading awareness. Thank you.